You are listening to Little River Radio, the official podcast for Little River Physical Therapy. On this podcast, we'll explore topics related to health, wellness, and injury prevention. I'm your host, Roxanne Darby. Keep in mind that every body is unique, and therefore the best approach to health for you needs to be individualized to you. Work at your own pace and mind your own body. The advice shared in this podcast is general wellness information and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you are seeking medical treatment or advice, please talk to your health provider and be sure to consult with your doctor before implementing any lifestyle changes. So, why is it that you don't drive? I was being driven to a babysitting gig by the dad of the toddler I was babysitting, and the conversation had already been excruciatingly awkward. He was one of those types of people that implicitly thinks other people don't have anything interesting to say until their 30s, and that dryly shuffles through conversations with people in their 20s with a disinterested, condescending tone that most adults reserve only for teenagers. I was 21, and he seemed to think he had lots of useful advice to impart to me. By this point in the conversation, he already doubted the practicality of my degree, advised me that life after college is harder than it seems, and told me how terrible I would find the job market. Oh, my license expired a few weeks ago, and it's just been a whole mess trying to get it renewed. There has been this huge backlog to get appointments at the DMV. Really? So you're saying you still drive? What do you mean, still drive? I thought maybe you didn't drive after your accident. What accident? I've never even broken a bone, never mind been in a serious accident, and I had no idea what he was talking about. That car accident you were in a few years ago, didn't you come into choir practice with sunglasses on because you couldn't look into the light? Oh, God, I don't know if you've ever been personally victimized by the dramatization of events from your former 18-year-old self, but I certainly have. When I was 18, I was in a car accident that resulted in me having a pretty minor concussion. From the perspective of my neighborhood's sleepy church choir, I guess this was a pretty dramatic event. Ironically, even though I was certainly a dramatic teen, I was actually trying my hardest to make as little deal as possible of the concussion and get back to ordinary life as fast as I could. Yet, of course, getting back to everyday life while I was still wearing sunglasses made the whole scenario seem much more dire than it was. I had my concussion in 2018 when a car swiped the passenger side of my car as they tried to merge while I was at a red light. My main memory of the event is an old man on the side of the road suggesting that I duct tape the bumper back on and holding the bumper while I taped it back onto the car. But I didn't actually notice my brain was feeling any different until 2 days later when I was trying to type up one of my final papers for high school, and the glare of my laptop screen was giving me a terrible headache. Later that day, a doctor diagnosed me with a mild concussion. However, despite being only 7 years ago, the advice and medical knowledge given for concussions in 2018 was very different than what we know today. In 2018, I was advised to basically do nothing until I felt completely better. This meant no staring at screens or doing basically anything that would require me to focus my eyes, such as reading or any of my homework. I was supposed to stay home and just rest my brain. It was recommended that I not do any physical exercise or anything that required mental exertion. Basically, the assignment was to method act as a rock. For a very energetic and easily bored teenager with just a few weeks left until her final exams for all of high school, this was devastating advice. But to be honest, I didn't really follow it. I tried it for the first couple of days to do nothing like what they recommended. I remember flopping on the hammock in the yard and calling my aunt, who always has good gossip, but after a couple of days, the advice not to do anything was making me feel worse. I started slowly seeping back into doing regular things, even things that were explicitly forbidden by the doctor, like watching TV. There was a bizarre Australian show about detectives solving a murder mystery who lived in trailers that I binge-watched during this time, but I've never seen evidence of since. And I started going back to school and studying basically as soon as I could manage it at all. Even if it meant going with sunglasses to protect my eyes and taking frequent breaks in the nurse's office, it just made my body and mind feel so much better to actually be doing something. Maybe it was just the fact that I was more distracted from the headaches, so they didn't feel as bad, but it didn't really matter to me what the science was. I just knew I felt better doing things than laying about at home. However, today, in 2025, the latest research on the best way to recover from a concussion is very different than the advice I was given in 2018. Let's get into it. Today's topic is concussions. Take a moment to imagine in your mind a person who has just had a concussion. What do they look like? What do they do for work? Are you picturing an athlete? Maybe a football player? Maybe even a soldier who was injured in combat? I bet you aren't picturing an out-of-shape office worker who was recently in a car crash, but the office worker also has a concussion, and most of the research on concussion recovery is focused on athletes and people in the military. In fact, there is no standardized set of guidelines for concussion recovery for a normal person, and barely any research done on it. And many concussion patients already have pre-existing balance conditions that cause them to get to the concussion in the first place, and there is little to no research on that. Today's episode will be focused on concussion recovery for non-athletes. We will talk about how physical therapy can be helpful in the recovery process from a concussion, and even how it can be an essential component of a full recovery. I'll break down some new neuroscience findings on the benefits of receiving physical therapy early on when recovering from a concussion, based on a recent study that specifically looked at the normal population, rather than focusing on professional or college athletes. I'll also share some tips on how you can incorporate the wisdom of physical therapy if you or a loved one is ever recovering from a concussion. Let's get started. A recent study published in Physical Therapy and Rehabilitation Journal, conducted by Dr. Laurie King, a professor of neurology who's also a physical therapist, and funded by the Department of Defense, looked at the effects of receiving physical therapy treatment that started 2 weeks after the concussion, and compared it to the effects of receiving physical therapy treatment 12 weeks after the concussion. Their hypothesis was that earlier physical therapy treatment would have better patient outcomes than later treatment. All the patients in the study were in the subacute phase of healing. The acute phase of an injury is when the injury is very recent and vulnerable. For certain types of injuries, the acute phase can be too early to start physical therapy treatment. The subacute phase of healing means that the body has already begun to heal itself. Additionally, the patients had to have some problems with balance caused by the concussion to be included in the study. The study found that patients who received physical therapy soon after their concussion were able to recover faster than patients who received physical therapy later in the recovery process. Additionally, patients who received physical therapy early on were able to fully recover their sense of balance, but patients who received physical therapy later were able to improve their balance but never made a full recovery. Overall, the study found that the recovery was faster and more complete if the patients were treated by a physical therapist soon after the concussion. This research was even picked up by the Washington Post. However, this is all new information and hasn't been implemented broadly yet. Unfortunately, most patients recovering from a concussion are seen by a doctor within the first 12 days, but it takes an average of 80 days before they are able to see a physical therapist, which is past the window of time in which physical therapy is most effective. Currently, when dealing with concussion patients, most doctors still apply the wait-and-see approach. The wait-and-see approach involves telling the patient to rest for 4 weeks with no medical interventions, and then only to seek medical interventions if they haven't recovered after 4 weeks. The tricky bit here is that 78% of concussion patients do recover within the first 4 weeks without any medical intervention. However, for those other patients that are still having balance issues after 4 weeks, even if they start physical therapy right away at that 4-week mark, it is unlikely that they will ever be able to make a full recovery. One of the benefits of going to physical therapy, rather than just attempting recovery exercises on your own at home, is that many people unintentionally hold themselves back from making a full recovery by avoiding movements and activities that are uncomfortable. And if you work with a physical therapist, they can push you to regain your full range of motion and full sense of balance. In addition to being applicable in concussion recovery, this is also a broader concept that can apply to physical therapy in general. In your daily life, you might be unintentionally overcompensating by avoiding things that make you uncomfortable. But however comfy that might make you feel, it will limit you from being able to make a full recovery in the long run. In the study, they had one group of people that were given a brochure on exercises to do themselves, but weren't working directly with a physical therapist. And because they avoided doing the difficult parts of the routine, they were never able to fully regain postural control, otherwise known as their sense of balance. But what would a physical therapy treatment plan for recovery from a traumatic brain injury actually look like? Let's break down the treatment plan for concussion recovery that they used in the study. Some of their recommendations might surprise you. For the first 15 minutes of the study, the patients would run or walk on a treadmill. The intensity of the treadmill would be determined by the results of the Buffalo Concussion Treadmill Test. This test involves the patient running on the treadmill while the therapist incrementally increases both the speed and inclination of the treadmill all the way up until the patient begins to experience concussion symptoms. Thus, they are able to find the patient's heart rate threshold, or the exercise intensity, which the patient is able to safely tolerate without triggering symptoms. The idea is the exercise brings much needed oxygen to the brain to help with recovery and to gradually increase the exercise tolerance. If you go to a physician after having a concussion, they would likely still tell you to rest without doing any exercise. However, that advice doesn't take into account all the most recent research, which is increasingly finding that you are more likely to make a full concussion recovery with some exercise, so long as it is below the threshold of experiencing symptoms. So, if your kid has a concussion, don't just keep them in the house. Even if they need some time off school, it's still healthy for them to be outside and running around, just so long as they stop once they reach the point of experiencing symptoms. They may even be able to gradually return to sports soon after the concussion. However, getting a second concussion while still in recovery from the first concussion is much worse than just one concussion and can cause serious long-term brain damage. So, although some movement is healthy, don't let your child return to a contact sport where head injuries are common until they have fully recovered from their concussion. The second 15 minutes will involve cervical treatment, which means treatment for the neck. Many times, a concussion will cause neck pain. This is for a couple of reasons. Often, the traumatic injury, such as a fall or car accident, will have twisted the neck in an unnatural position and physically damaged the neck. Other times, the neck pain could be caused by damage to the nerves connecting the neck to the brain. Or if the concussion caused vision damage, the neck may be moving more to see things, overcompensating for the damage done to the eyes. All of these issues can be treated with physical therapy. The third 15 minutes will be spent working on static and dynamic balance. Static balance involves standing in one position, such as standing on one leg. Dynamic balance involves having to retain a sense of balance while moving. The final 15 minutes will be focused on vestibular rehab. Vestibular rehab is focused on helping you manage dizziness, which will improve your sense of balance. Your vestibular labyrinth is a series of loops and canals in your inner ear that respond to gravity and movement. The vestibular labyrinth is what determines your ability to balance. But your vestibular labyrinth doesn't operate alone. It relies on closely integrating its signals with your visual input and the signals coming from your tissues. The tissues collect information based on the pressure they feel of being pushed into different positions and send that information to the brain. For example, if the tissues feel pressure on the back of your foot, it will let your brain know that you are standing rather than sitting. So any damage to your vestibular labyrinth, otherwise known as your inner ear, vision, or tissues could potentially cause dizziness and balance issues. Vestibular rehab involves not just the improvement of one of the components of balance, but the reintegration of all three components. The therapists measured the outcomes of the treatment using both patient-reported outcomes and more objective measurements. For the patient-reported outcomes, they used the Dizziness Handicap Inventory, which is a series of self-assessment questions for the patient to answer, involving questions like, because of your problem, do you feel frustrated? And does walking down a sidewalk increase your problem? However, patient-reported outcomes are notoriously unreliable. Patients have a hard time assessing if they've improved or how much they've improved because their symptoms vary so much throughout the course of a day. This is why physical therapists usually gauge progress by measurable changes such as balance tests and ability to return to previous level of functioning. Another way the therapists measured the outcomes of the concussion treatment was by having patients wear motion sensors on their trunk and hands while they did their exercises at home. And no, this wasn't some kind of sneaky trick for the PT to spy on the patients to see if they actually did the exercises they said they were going to. The monitors would sense how successfully they maintained their balance while performing the exercises and would send basic data back to the physical therapist about the motions of the patient's body. Physical therapy is a highly personalized form of medical treatment. Because of this, research studies within the field of physical therapy are difficult to conduct since they have to balance the treatment with incorporating enough standardization for the study while also making the treatment personalized enough to work for the patient's specific body. Another difficulty within physical therapy research studies is that a good study needs to have experienced physical therapists work directly with the patients. It doesn't work to have physical therapists just give the instructions to personal trainers or even physical therapy assistants because so many key decisions need to be made hands-on with the patient in the clinic. Thank you for listening to Little River Radio. If you have questions, comments, or suggestions about this podcast, you can email us at thelittleriverpost@gmail.com. Otherwise, I'll see you next time.